Hello, everyone, and welcome to Clock Talk with Dr. Greg Brannon. Greg, we have 15 minutes to talk about breast cancer. So we all know what it is. However, it seems today that more and more people are being diagnosed with it. It seems like cancers in general are, becoming a lot more prevalent, sadly. So why don't you just walk us through the ABCs of breast cancer, and we'll take it from there.
Yeah, 15 minutes on the most controversial topic in the world. That easy, no problem. Yeah, first thing, this is all my opinion. I'm not an oncologist, but I studied this stuff in detail. Cancer is when a cell grows uncontrollably. That's what cancer is. Why are we increasing? What's the cause? But here's the thing. In my field as an OBGYN, I dealt with a lot of breast exams, a lot of mammograms, biopsies, and things like that, trying to screen things out. When you look at the data of what's going on with all these different theories, genetics theories, but there's a great guy, Thomas Seyfried, out of Boston University. He wrote a book called Cancer is a Metabolic Disease. Great book. One of his theories on cancer in general is it may not be genetic because you find a lot of different types of genetic strains in a sample of a tumor. So his thing is, what's the step before that? And he's finding that we know it's called the Warburg effect. The cancer cells do not grow in what's called an oxygen, called oxidation. They use fermentation. They use sugar only. So some of his theories, maybe it's too much sugar leading to metabolism. That's one thing. Environmental, the fake plastics, the fake estrogens, all that could be. So a combination of a lot of stuff, Jim. But the bottom line is obviously early detection is crucial. Most breast cancer is found by the patient themselves by breast exam. So when we're talking about breast cancer and what we do here at Optimal Bio is hormones. Hormones cause cancer. And this is the thing that's very, very important to understand the data on that. 1931 was the first time scientists isolated the molecule testosterone. By 35 was the first treatment actually to women. Women had hysterectomies, and they did it via pellets. A woman's breast tissue has receptors for hormones. Estrogen receptors, progesterone receptors. We know that because the way a breast sort of cycles like ovaries does. The hormones affect the gland structure. We know iodine is extremely important for breast. Iodine, to keep the glandular structure, you must pump one molecule of iodine in and 2 sodium out. It's called sodium-iodine system. So, but when do women have their highest estrogen levels, highest progesterone levels? And oh, by the way, there's more testosterone receptors in breast tissue than there are estrogen receptors, okay? When they're young and healthy, very few cancers happen at that time. They usually happen when hormones are going down or gone. So when you ask about estrogen, does it cause cancer? Well, then I ask another question. There's 3 types of estrogens. But actually 4 count fetal, but there's E1, E2, and E3. E1's the most prominent as you age. E2 is the most potent when you're young. And interesting, in the breast tissue, Jim, E2 estradiol actually downregulates its own receptor production and increases the progesterone receptor site. So it's actually anti-cancer growing in the breast. So from 1935 to 2002, 77 years of literature, virtually every major paper said nothing about hormones causing breast cancer. Then the famous WHI paper came out. There's a phenomenal book called Estrogen Matters that takes that whole study apart. But when that paper came out, though, I called Dr. Michelle, one of the most famous OB-GYNs in the world, up. I talked about the paper. I said, we've been trained to give that. And we had a long conversation. He recommended I still can educate my patient and keep them on that. But this study was very interesting. The Wall Street Journal, New York Times, whatever came out the next day in the paper was hormones cause breast cancer. Well, in that study was not hormones. It was Premarin, which is pregnant female horse urine, which is predominantly estrone, the E1 again, the horse version of that. The progesterone arm was not progesterone, but progestin, called Provera. So one arm was Premarin by itself. By the way, it did not increase breast cancer. The other arm was Premarin plus Provera. That arm increased breast cancer 24%. But even look detailed in that data, it was skewed for older people and things like that as well. So other risk factors. Again, estrogen matters can't look any better at that. But 3 years later, Dr. Fiornero in France did 2 major studies. He wanted to see what the culprit was. So he had 134,000 women in his study. He gave them estrogen, bioidentical, and progesterone, bioidentical. That arm decreased breast cancer, decreased it 10% because it mimicked the theory behind a younger biochemistry. The other arm was estradiol, bioidentical, and Provera. the synthetic progesterone called progestins. It increased breast cancer 69%. Just because it's a progestin does not make it equal to progesterone. That seems to be the culprit mainly in that study. So there's some great studies out of Europe showing actually women who have breast cancer who go on bioidentical pellets, estrogen, testosterone, together actually decrease reoccurrence. But in America, it's important to understand, we follow the guidelines. You cannot give a bioidentical hormone of estrogen to a person who had breast cancer for the first 5 years. But the studies show, and uterine cancer 2 years. But there's a thing called BRCA, which is we know that's a genetic form. About 5% of breast cancers are that way. But the studies there show it's better to give to give hormones in general. They group them all together for the protection of the heart and the brain and the bone than the risk of it causing cancer. That's for the highest risk person.
So when we talk about synthetic versus bioidentical in this case, it's not synthetic testosterone that's causing the uptick in cancer. It's the other synthetics you just described.
Right. It's the progesterone. Not even the synthetic. The synthetic Premarin did not. Johns Hopkins went back and looked at that paper. Again, I can't stress the book Estrogen Matters. It's phenomenal. Hopkins went back and looked at how many potential lives were saved by stopping Prempro. That's the one it was. They picked that because that was the one that was used the most. And they found 19,000 to 91,000 extra lives were cost by stopping because of the increase in dementia and cardiovascular disease. And then they went back and looked at the women who had breast cancer and said how they were doing. They were living longer. They had breast cancer, but longer is less dementia and cardiovascular disease. So that's why it's important to understand that. Now, Jim, they're doing some studies mainly in Europe where they're actually with breast tumors, they're putting testosterone pellets around the tumor prior to treatment.
They're not doing that in the U.S.?
Some places, yes, but it's not standard care. This is obviously studies going on now.
So you want to discuss the 2002 Women's Health Initiative? Is that what you talked about before? Okay, great.
That was it. And also, but the Premarin arm, the arm that's the horse estrogen, the Premarin arm had decreased colon cancer, decreased osteoporosis, but it did affect liver and clots because it's orally taken. So again, I was looking when we started doing this was Optimal Bio was can I get the benefits and decrease the risk factors tremendously? And that's why I went back to the idea of the structure, and I can't stress this enough. Bioidentical is no marketing thing. This is important. Pharmacy companies, with all their great work they're doing, they cannot own an organic molecule. They can't patent it. So they got to manipulate or invent another one. But when you look at endogenous, and that's why our body makes it, all bioidentical is a copy of that. And again, the Mayo Clinic's definition of it is called body recognizes as same, not foreign. And that's important. So then the body knows how to utilize it, to metabolize it, and to eliminate it. Nothing special, not messed up. The synthetic arm and testosterone, I've talked before, there's three subgroups. There's the ester, which is testosterone molecule bound to this group that allows it to stick in the muscle and last a little longer. There's one called 19-nortestosterone, which is also an injection, and then one's called the 17-alkylation, which allows to take oral. That one affects the liver. They're all beneficial, but there are more side effects of blood clots and blood pressure. But the big one for all three of those, Jim, has been shown, a great book out of Belgium that shows it increases neuronal death. So there's some studies to increase dementia as you age. The bioidentical, just the opposite. It causes brain to make more brain, neuroplasticity.
I mean, to me, I'm a male, but this whole concept that hormones cause cancer, breast cancer in this case, it's very cloudy. I think if you're just the average woman and you're trying to figure out, whether or not, BHRT, is going to be good for you or not. Right. Very few people are going to go dig deep in these studies to see what was actually, given. So what's some of the advice you can give, the typical patient that's looking, for hormone treatment at this point?
Most women who get breast cancer were never on hormones. The highest hormones in their life is when they're younger and having babies.
Right, but I'm talking about the ones that haven't had cancer, thankfully.
I'm talking that haven't had cancer. I'm talking this, so you start looking logically, it's like, so when their highest hormone levels endogenous are that, there's very, very rare cancers in young people. It happens when I draw this diagram where I put people born, they go to heaven, there's menopause. Where's heart attack? Where's breast cancer? Where's stroke? Where's dementia? It's on this side. How does it differ on this side versus this side? No testosterone, no estrogen, no progesterone. So I believe these things are keep you healthy. So that's important. It is very, very, very complicated, and I got that. In our new book called Restore, it's coming out, I think Forbes published late March, early March of next year. In my breast cancer section, Jim, what I did was in the section, not at the back of the book, I put 83 references, 83 right there on that page. Estrogen Matters on the beginning of their book has multiple studies showing the benefits. In Europe, again, by the menopause treatment, they're showing that shows none of that. Very interesting, though. We're one of the few countries that don't believe women even need testosterone. And testosterone is about 30 to 50 times higher in women than estrogen when they're younger. There's more estrogen receptors and testosterone receptors in breast tissue than there are estrogen receptors. It's, again, do you want an 18 to 20-year-old hormones or do you want a 80-year-old hormones? And the question, but Greg, I age, part of aging. I'm not anti-aging. I love aging. There's wisdom with aging. I love all that. But I believe we should look at aging as a disease. Again, the book called Ageless goes through that in very good detail. So if we could look and nip these things off in the bud. The problem is, Jim, cancer is so... A woman as they age, the number one cause is not breast cancer or death. It's cardiovascular disease. And this protects that. That's why it's important to look at overall numbers. I think we do, Jim, we talk about what do the patient. I walk through the numbers, look at the data on that.
So I noticed recently that I read that they're dropping the age requirement for, they're lowering it for mammograms. It's to 40 now. Any thoughts on that? Why?
Torn on that. As an OB, I stayed the standard. It was 35 to 40 a baseline, 40 every year of the year, 40, 50 every year. I think that's the standard they should follow. I can't stress enough, self-exam is very important. Again, most early cancer found by self-exam. So that's still fine, but we're talking earlier, how can we, I hate the word perfect, but I'm not a cancer doctor, but what's the cause? You find the prevention. So again, it goes back to, you look, there's a good book called The 100-Year Lie about the FDA, and it shows our cancer rate was 1% back then. Yes, we lived less. I understand that. But why do we have less cancer? Why do we have less diabetes? And I think we have 90% of our food we have today we didn't have then. I think it's so multifactorial, Jim. It's not just one thing. So again, sleep is wonderful. Eating is wonderful. These things are crucially important. But I think the confusion part is, Jim, when you look at just sheer numbers, look at the body. What we're going to die of mostly, brain and heart and those kind of things. Hormones help keep those things more vitalized. So, but if your risk factors, we got to keep the eye on that. But again, the highest risk factor for breast is BRCA. And the American, the Oncology Society recommends BRCA be treated with hormones for the helping of dementia and cardiovascular disease.
For those that have gone through breast cancer and they're post-treatment, a lot of them are still on medication. Yep. What are some of the positives and negatives to that medication?
Well, the bottom line is when they get to, again, it's a stage ER, what kind of, is it a aromatase inhibitor? Is it surgery? Is it chemo? There's a bunch of prospects. So we always recommend you follow up, get your plan done. But when you start having no estrogen treatment, what happens is the vagina changes dramatically. You lose more bone rapidly. We know the brain needs hormones. So we'll start testosterone earlier, and then after the 5 years, we could add the estrogen back to them. And when we do, we have scores of women that have this. We have oncologists here in town refers me patients after the 5 years because of the protection of the heart and the brain. And the bottom, it's really important to understand that peeing and pooping is crucial as you age. And they get their life back that way, Jim. So there's just the fear of the death of cancer. You look at the numbers is very small compared to what's going to happen if you don't keep your hormone levels or your health higher. So we just go over the data.
But aren't some post-treatments after surgeries, after whatever, they're on some type of hormone?
Oh yeah, this aromatase inhibitor. So these medications, they turn off the production of the hormone. And estrogen has an alpha receptor and a beta receptor. It's important too. Alpha is pro-growth, beta is negative growth. Simple. E1, which dominates as you age, is 5-to-1 alpha. The E2, which is when you're younger and the more potent one, is neutral. So therefore, it's more protective in the breast tissue again. So I'm trying to replicate the young biochemistry in the breast, in the body, in the brain, the heart by keeping the levels of those numbers. And again, testosterone has been shown now to be very beneficial. Anti-cancer protection.
Fascinating as always. You have 15 seconds left. Anything else you want to add?
Very personal decisions. This is extremely difficult. Please do your research, spend your time, and get all your questions answered regardless. That's bottom line.
Clock Talk with Dr. Greg Brannon.